Sclerotherapy for treatment of varicose veins. What your patient should know. What are varicose veins? Varicose veins are superficial veins of the leg that are pathologically enlarged and often appear twisted and bulging. About 60% of all adults in Germany suffer from small varicose veins, and 20 to 30% from larger varicose veins with symptoms or complications. Varicose veins are thus a widespread disease that must be taken seriously. The following chapters will help you understand this disease and inform you on how to react to it. The cardiovascular system. The cardiovascular system is a transport system for oxygen and nutrients that includes the heart, a network of blood vessels, and the blood itself. The heart is the motor, and the blood vessels are the tube system in which the blood circulates. The blood vessels consist of so-called arteries and veins. The arteries, shown here in red, transport the blood that has been enriched with oxygen in the lungs from the heart into the body to the organs and muscles. The oxygen and nutrients are delivered to the organs and muscles from the blood, and waste products are absorbed by the blood in exchange. The veins, shown here in blue, conduct the blood that is now low in oxygen and full of waste products back to the heart and lungs. The blood receives a new supply of oxygen in the lungs, from where it is transported back to the body, repeating the circulatory path once again. How do the veins transport the blood back to the heart? When the leg veins transport the oxygen-deficient blood back to the heart, they have to work against gravity. The veins are equipped with so-called valves so that the blood will flow in the right direction. The venous valves open when the blood flows towards the heart. They close when the blood begins to flow in the wrong direction. The venous valves thus make sure that the blood can only flow in one direction, back to the heart. Besides the venous valves, the so-called muscle pump also plays an important role in transporting blood against the pull of gravity. The large veins in the leg are surrounded by muscles that tense and thicken when we walk. This muscle action presses on the veins and pumps the blood upwards. When the muscles relax again, the venous valves prevent the blood from flowing backwards, as described above. There are deep leg veins and superficial leg veins. The superficial venous system runs in and just below the skin. It transports blood from the skin and sublayers of the skin back into the deep venous system, accounting for about 10% of the return transport of the blood. The deep venous system is located deep inside the legs. It transports about 90% of the blood back to the heart. The superficial and deep venous systems are interconnected at certain places by connecting veins. How do varicose veins develop, and what symptoms do they cause? As we mentioned at the beginning, varicose veins are pathologically enlarged veins of the superficial venous system. Doctors refer to them as varicose veins or varices. Varicose veins develop if congenital connective tissue weakness leads to expansion of the venous walls, and the venous valves no longer close properly, and thus cannot fulfill their function. Gravity pulls the blood in the wrong direction, whereupon the blood remains in the leg and causes congestion. This further increases the pressure in the blood vessel until varicose veins develop. Besides a congenital connective tissue weakness, certain other risk factors also encourage the development of this condition. These risk factors include advanced age, pregnancies, the intake of hormones, for example, the pill, lack of exercise, and overweight. What symptoms are caused by varicose veins? Many patients first see a doctor because of the unattractive appearance. Even spider veins can cause symptoms and may be the first visible signs of increasing venous weakness. The most frequent symptoms of varicose veins are tingling, stabbing pain, and a tense sensation in the legs. Tired and heavy legs, itching, water accumulation around the ankles, and cramps may occur as well. Unless it is treated, the disease gets worse, possibly resulting in skin discolorations and chronic skin inflammations. At worst, venous inflammations, thromboses, and ulcerated legs may occur. Varicose veins should therefore be taken seriously and treated. Consult your family doctor or a vein specialist, also known as a phlebotomist. How does a doctor diagnose varicose veins? The diagnostic tests used today are simple and painless. The doctor will first ask about your history of illness, for instance, how long you've had varicose veins and what symptoms they cause. At the following physical examination, the legs will be carefully examined and felt while you're standing. The doctor will look for visible varicose veins, swellings, and changes in the skin. An important tool in further diagnosis is the use of modern ultrasonic devices that scan so accurately that they create images of the diseased parts of the venous system and can assess the severity of the varicose veins. What is sclerotherapy, and how are varicose veins treated? Sclerotherapy is a method that requires no incisions and no hospital stays. It's been shown for many years to be a reliable way to eliminate varicose veins. The principle is simple. The varicose veins are eliminated by injecting a so-called sclerosing agent into the veins. Using a fine needle, a liquid, the sclerosing agent polidocanol, is injected directly into the diseased veins. The sclerosing agent pushes the congesting blood out of the varicose vein, seen here as the immediate decoloration of the vein. Inside the varicose vein, the sclerosing agent reacts with the vein wall. Normal processes in the body then cause adhesion of the venous walls, thus closing the vein so that no more blood can congest in it. In the long term, the diseased vein is converted by the body into connective tissue and disappears over time. This process may take several weeks. Physicians can treat all types of varicose veins using sclerotherapy. The small varicose veins include spider veins, the smallest varicose veins in the skin, and reticular veins, which are somewhat larger. The reddish or bluish varicose veins are often found on the sides of the thighs and lower legs in fan-like or net-like patterns, and many patients find them cosmetically unattractive. Sclerotherapy, also called microsclerotherapy, is the treatment of choice for spider veins and reticular veins. Larger varicose veins may develop from saphenous veins or their side branches. The two main superficial veins of the legs are called the saphenous veins, the great and small saphenous veins. Pathological enlargements of these veins are known as saphenous varicose veins. So-called side branches branch off from the saphenous veins. Pathological enlargements of these side branches are called side branch varicose veins. To treat larger varicose veins, a foamed sclerosing agent is often used instead of the liquid agent due to the stronger effect of the foam. The sclerosing foam is prepared by the doctor or medical assistant immediately before treatment. Sclerotherapy with foam is carried out under ultrasonic control to assess the position of the varicose vein precisely and determine the best injection site. The foam is injected directly into the varicose vein. Here as well, the diseased vein is eventually converted into physiological connective tissue. The varicose vein can thus no longer cause any symptoms. Sclerotherapy can thus eliminate troublesome varicose veins without hospitalization, lasers, surgery, or anesthesia. The treatment is safe and effective, and in most cases causes no pain. Several sessions may be required for optimum results, depending on the extent and degree of the disease. What happens after sclerotherapy? Upon completion of sclerotherapy, an adhesive tape is applied, then a compression stocking or bandage. Patients should walk for about 30 minutes directly after the treatment. To ensure treatment effectiveness, compression stockings should be worn for several days for smaller varices and for several weeks for larger varices. During the first few days after treatment, do not go on long trips by air, bus, or car, or carry out endurance sports. Do not take hot baths and avoid saunas, sunbathing, and sunbeds. Varicose veins are a chronic disease. This means new varicose veins may develop over the years despite successful treatment. You can keep your legs attractive and healthy with regular professional checkups.